1. Which of the following best describes radical behaviorism? A. It focuses solely on observable behavior. B. It includes private events as part of the analysis of behavior. C. It denies the existence of mental processes. D. It incorporates elements of Freudian theory. 2. The assumption of determinism in behavior analysis means A. All behavior is random and unpredictable. B. Free will plays a large role in behavior. C. Behavior is influenced by environmental and genetic factors. D. Behavior is determined by thoughts and emotions. 3. Which is an example of a conditioned reinforcer? A. Water. B. Food. C. Money. D. Pain relief. 4. Negative reinforcement involves A. Adding a stimulus to increase a behavior. B. Removing a stimulus to decrease a behavior. C. Removing a stimulus to increase a behavior. D. Adding a stimulus to decrease a behavior. 5. A stimulus change that functions as reinforcement due to its association with other reinforcers is A. Unconditioned reinforcer. B. Primary reinforcer. C. Conditioned reinforcer. D. Negative punisher. 6. The most appropriate measurement for continuous observation of high-frequency behavior is A. Duration recording. B. Whole interval recording. C. Rate. D. Momentary time sampling. 7. Interobserver agreement is most critical for A. Displaying trend. B. Ensuring data reliability. C. Implementing reinforcement. D. Conducting preference assessments. 8. Which of the following is considered a depressant? A. Cocaine. B. LSD. C. Alcohol. D. Methamphetamine. 9. A reversal design is best for demonstrating A. The correlation between variables. B. The generalization of behavior. C. A functional relationship. D. Interobserver reliability. 10. What design allows for the replication of behavior change across settings, behaviors, or individuals? A. Alternating treatment design. B. Multiple baseline design. C. Changing criterion design. D. Reversal design. 11. Which of the following best defines a functional analysis? A. A description of a person's personality traits. B. An assessment of academic abilities. C. An experimental analysis to identify function of behavior. D. A subjective interview with a parent or caregiver. 12. ABC data collection involves A. Asking questions about behavior. B. Measuring latency. C. Recording antecedents, behavior, and consequences. D. Evaluating skills with a standardized test. 13. Which of the following is an example of differential reinforcement of incompatible behavior DRI? A. Providing reinforcement only when problem behavior does not occur. B. Reinforcing sitting when the problem behavior is standing. C. Delivering reinforcement at fixed intervals regardless of behavior. D. Reinforcing behaviors other than the target behavior. 14. In behavior chains, which type of prompting is most commonly used? A. Most to least. B. Least to most. C. Graduated guidance. D. Time delay. 15. A behavior analyst uses shaping when A. Punishment fails. B. Teaching complex verbal behavior. C. Reinforcing successive approximations of a target behavior. D. Using extinction alone is ineffective. 16. Effective behavioral interventions must be A. Peer-reviewed and costly. B. Socially valid and evidence-based. C. Complex and subjective. D. Infrequently reviewed. 17. A token economy is an example of A. Negative reinforcement. B. Generalized conditioned reinforcement. C. Unconditioned reinforcement. D. Punishment procedure. 18. What is most critical when planning for generalization? A. Using the same stimuli in all settings. B. Limiting the behavior to one context. C. Training across multiple exemplars. D. Avoiding maintenance checks. 19. Which is an example of performance feedback? A. A written task analysis. B. A weekly newsletter. C. A graph showing target behavior trends. D. Praise following accurate implementation. 20. Behavior skills training BST includes all the following except A. Instruction. B. Modeling. C. Memorization. D. Feedback. 21. According to the BACB Ethics Code, dual relationships should be A. Encouraged for rapport. B. Allowed if consensual. C. Avoided whenever possible. D. Ignored in educational settings. 22. What must a behavior analyst do before implementing a restrictive procedure? A. Ensure no consent is needed. B. Review with a multidisciplinary team. C. Conduct a descriptive assessment. D. Consult a psychologist. 23. The principle of beneficence requires that the behavior analyst, A. Prioritize client well-being. B. Ignore client preferences. C. Only follow employer instructions. D. Disregard data trends. 24. Which is a valid reason to terminate services? A. Disagreement with staff. B. Client no longer benefits from services. C. Client requests a different provider. D. All of the above. 25. What is matching law? A. A principle describing rate of response based on delay of reinforcement. B. A law defining reinforcement schedules. C. A formula that predicts allocation of responses based on rate of reinforcement. D. A guideline for discrete trial training. Board Certified Behavior Analyst. The Board Certified Behavior Analyst (BCBA) certification is a graduate-level credential offered by the Behavior Analyst Certification Board (BACB). The BCBA exam assesses a candidate's knowledge and application of behavior analytic principles and practices, including ethical and professional conduct, experimental design, behavior assessment, intervention strategies, and supervision. To qualify for the exam, candidates must meet specific educational and supervised experience requirements. The test consists of multiple-choice questions designed to evaluate the ability to design, implement, and evaluate behavior intervention programs. Passing the BCBA exam is essential for professionals seeking to provide behavior analysis services independently or within organizations, particularly in clinical, educational, and therapeutic settings. Here are the top 5 beneficial uses of the sample exam. 1. Professional credentialing. The BCBA test provides a recognized certification that validates expertise in behavior analysis, allowing professionals to work independently or lead clinical teams. 2. Career advancement. Certification opens doors to advanced roles in healthcare, education, and mental health, increasing job opportunities and earning potential. 3. Improved client outcomes. Certified behavior analysts are trained to apply evidence-based strategies effectively, leading to better treatment outcomes for individuals with behavioral challenges, including autism and developmental disorders. 4. Ethical practice assurance. The exam ensures that practitioners understand and follow ethical guidelines, promoting integrity in service delivery. 5. Global recognition. The BCBA credential is internationally respected, enabling certified professionals to practice and consult across various countries and professional settings.